Well, Dr. Matt, I wanted to tell you I appreciate you taking some time with me today to talk to you a little bit about your chiropractic office and how you do things. Let's just go ahead and get started, if that's okay with you.
Absolutely.
Well, my first question is, what was your motivation to become a chiropractor?
So my motivation to become a chiropractor probably started early on with my deep desire and passion to help people. So I didn't know quite what that looked like or how I was going to help people. But it really started when I became a massage therapist and I worked for a chiropractor.
Okay.
So I was seeing people doing massages, but seeing the chiropractor and what he was doing for people, literally changing people's lives, was mind-blowing to me. But the light bulb didn't really go off until I saw the changes in myself. So I had a lot of ailments, back pain, neck pain, shoulder pain. So all of that started getting better. But the real thing that kind of got me on the path of knowing I wanted to do chiropractic was I had chronic bouts of digestive issues, strep throat, all these different things that never thought a chiropractor would be able to help with, and they all miraculously went away. So I knew then, like, I had to share this first and foremost with my family and friends, and then with the surrounding community.
So the patient became the doctor.
Pretty much.
Oh,
yeah.
that's really cool. When you got into the chiropractic field, and you were going to school and everything, what methodology did you start to kind of lean toward, and why?
So that took me on quite of a journey. So that was when I first started getting adjusted and I worked for the chiropractor. All I knew is what that guy did for me, how he adjusted me, so that's all I knew. But the one thing that kind of set things apart is people got well. A lot of people got well, but still people had questions. So they didn't feel like they were getting their questions answered by the chiropractor. No beef against him. They just still had questions. And I just kept listening because I would see every patient for a couple minutes before the chiropractor would come in. So time and time again, more and more people, just more questions. So I just kind of had a drive to find a technique, a specific technique that could maybe answer those questions, or further studies that I could do to get to the answers for those questions for those people, so I could help that many more people.
Okay. And what was that method?
So during school, you're allowed so many different, at Logan, here in Chesterfield, in St. Louis, Missouri, we're allowed to, there's so many techniques that you're not subjected to, but that you can take as an elective.
Okay.
So I tried many different techniques, and the one that just stood out and was a no-brainer for me was called SOT.
Okay.
So SOT is the abbreviation SOT is sacro-occipital technique.
Okay.
So it's a very thorough technique. So there's a lot of checks and balances. So it's very specific to the patient when they come in. So it's a means of assessing exactly what needs to be addressed that day. And then once we address it, then the indicators that we look for go away, so we know that we made the correction for that day. So again, it's like a checks and balances, but it's an all-encompassing technique. So not only addresses anything from your cranium down to your feet and everywhere in between, but organ function. So it looks at a little bit of everything, and again, it's checks and balances, so we know we're making the corrections, and the patient can see the corrections as we go along.
Okay. Now, along with the SOT method, is there anything else that you incorporate in with that?
We do. So when individuals come in with specific complaints, we take care of them within the chiropractic world as best we can, and then if they don't respond like we expect them to, or if they have further issues, digestive issues, blood sugar issues, thyroid issues, whatever they may have, Then we can look at further testing, such as blood work or saliva testing, to look at possibly, we call it functional medicine, to look at dysfunction before it gets to pathology that they might not get in a medical model.
Okay.
So then we can address it through dietary changes, supplementation, and try to help them so that then they can get over those hurdles. And like I said earlier with the questions that people had, that is one of the major stepping stones that I found to help my patients even more, is the functional medicine and other services that we offer in our office.
Okay. So basically, you can look at and tell when a person has some things going wrong, but they're not at emergency room level then.
Correct.
You can kind of taper that off and get that back in order so that they don't have to go to the ER.
Ideally.
Okay.
So
Okay.
based on their symptoms, how they're responding to care from a chiropractic standpoint.
Mhm.
So when their symptoms aren't changing and they're having other symptoms, so it's kind of very unique to that individual. And then based on that, we never can diagnose anything or treat anything, but we can support normal processes throughout the body
Mhm.
with those things that I just mentioned, with dietary changes, supplementation. So we allow the body to heal itself, but again, before it gets to pathology, like you said, before they're in the hospital, hopefully help them before they even get to that point.
Okay. Great. Now, what if you have a patient of yours that actually is under doctor care for, let's say, diabetes? Is there anything that you can help them with as far as along those lines?
Absolutely. So when we look at chiropractic and what we do as chiropractors is we free up nerve interference. So if there's misalignments within the spine, anywhere in the spine, it can interfere with the nerves that come out of that level. And a lot of times it's in the areas of, say, your pancreas. So your pancreas secretes insulin when you eat. So a lot of diabetics have problems with insulin. So if we start with the chiropractic part of it, making sure the nervous system is functioning properly, that's the kind of the baseline. We absolutely will start there. But then we can also look at supplementation and dietary changes to definitely support the diabetes, whichever one it is, if it's a type 1 or type 2.
Okay.
And we work directly with the doctors too. So sometimes people are allowed, or not allowed, sometimes people, when they start balancing things out, they don't need their meds as much. Or sometimes they've been able to get off of their meds.
Okay.
Now that's something that we tell them up front. Like, we can't tell you anything about your medicines. Like, you have to follow up with your medical doctor for that. And there's nothing I can tell you about your meds. But we would help support all the other areas and support normal processes in your body, not treating anything.
Okay. Have you addressed any other type problems that people had, like ADHD or other things that are kind of common in our world today?
So a lot of times what we find are thyroid issues. So a lot of thyroid issues, a lot of autoimmune issues, a lot of digestive issues, IBS, which is kind of a blanket for your bowel dysfunction.
Okay.
We don't know what's wrong with you. Colitis, Crohn's disease. So a lot of digestive, thyroid, blood sugar, and also a big one right now is SIBO, small intestinal bacterial overgrowth.
Mm-hmm.
So all of these things, allergies, like food intolerances. So there's many different things people come in with that we've been able to help with.
Wow, that's awesome. Now, when you're looking at your office, you have the chiropractic, and of course you address things too on a nutritional level, on certain things. Are there any other services that you offer here?
We do. So massage therapy. So we have a great massage therapist, and we have an acupuncturist. So she practices Chinese medicine.
Okay.
So both of those kind of go hand in hand with the chiropractic, where we're looking at the entire body and how everything's connected and how we can better balance that system with all of those different various techniques and services.
Okay, great. Well, I think that's all I had for you today.
Great.
I really appreciate your time. This has
Absolutely.
been very informative. Thank you very much.
Absolutely. Had to get the phone ringing in the end there.